Maria Holder Diabetes Center.
I want good health for Christmas.
If you want good health for Christmas, this is the show you need to listen to, because it's time for 15 diabetic-friendly Christmas minutes, all being brought to you by the Barbados Diabetes Foundation.
I would like good health for Christmas. So what's happening in this show that will help me do that?
In today's show,
Hey everyone, I'm Marsha White. This Christmas, one of the tips that I would give to you.
stay tuned to hear what Marsha's Christmas tip is today and how it might change your life.
Well, it's Christmas now, so I could as well wake up and have a conky and a juice for breakfast.
Find out from dietitian Victoria Cox how you can eat healthy this Christmas and not sweet drinks or conkies. And hear an exclusive phone call between Alfonso and Santa Claus. You think I'm frightened? I call Santa Claus. All this and more with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Cream Program, and the bank that can make your Christmas a dreamy reality. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money, but members get 10% off.
Good Saturday morning, VOB peoples. This is Peter Boyce here, and it's the last Saturday before Christmas. And you know the Maria Holder Diabetes Center, located in Warren, St. Michael, is especially designed for diabetics and pre-diabetics, and they want you to have good health for Christmas. And that's why you can hear the Christmas song in the background by the cameraman. Good health for Christmas, and you'll be hearing that song all throughout the show. So let's take in some of these healthy lyrics just before you hear Marsha's Christmas tip and more.
Don't want no diabetes. Don't want no cancer.
The Maria Holder Diabetes Center.
No STDs. I want to live longer. Good health for Christmas.
Hey everyone, I'm Marsha White from the Barbados Diabetes Foundation. Season's greetings. This Christmas, one of the tips that I would give to you is to save your carbs, your carbohydrates, that is, for last. That will help to reduce the spike in your blood sugar. So eat your protein, eat your fat, eat your non-starchy veggies, and save those carbohydrates for the last thing you eat. And that goes for dessert as well. Sweet treats always at the end of a meal.
Too much sugar, it bound to kill ya. Too much salt, I tell ya. That is high blood pressure.
The Maria Holder Diabetes Center.
Good health for Christmas.
Hello? Santa Claus? There's Alfonso here. How things is up at the North Pole? I just say we'll call you and see how things going. Listen, you need to pass Barbados when you're dropping off presents this year, here? I know we ain't got no chimneys now, don't afraid to come down, but you can still pass and pelt gifts through people's windows. We won't complain. Anyways, my call you about right, Santa, is I noticed that you've been looking a bit on the plump side with all that black cake and Christmas cookies that you've been eating. So, when's the last time you get a health checkup? You got asked, Rudolph, the reindeer? Well, ask you then. Cause down here we got the Maria Holder Diabetes Center where you could drop in Saturday and you could get a checkup. It's located in Warren St. Michael. They got ample parking up there, so you got some place to park in Slay. And then you could get your blood pressure check, your blood glucose, you could check your kidney function, you could check if you got protein in your urine. And I know this you be wearing them big Santa Claus boots, but you ain't fooling nobody, cause you may be holding swell ankles. Well, you could also get circulation testing and vascular screening, and also you can get a body mass index too. All that you can do, Santa Claus, and it's cheap too. You won't have to kill a reindeer to pay for it. And if there's a bar member, you get a bar discount off. I know where you is. You gotta think about it. No, it does not have to be a diabetic. It could be Maria Holder Diabetes Center. Because I know you be flying around delivering gifts. Next thing you know, you will fall down bad fields. Alright, Santa Claus, so you take care and be careful flying around Venezuela this year, alright? And remember, Santa, the Maria Holder Diabetes Center, pass through and get a checkup. Get to know where your health numbers is. And once you do, you can find out what Dr. Diane Bradford want for Christmas. And try and draw some gifts out to Barbados this year. We ain't nobody. Anyways, I go on.
Ho, ho, ho! Merry Christmas!
Merry Christmas to you too, Santa, and all the Maria Holder Diabetes Center fans that are listening.
The Maria Holder Diabetes Center.
I know it's a lot of people out there listening to VOB likes to eat and drinks bad for Christmas. I like to eat and drink bad too. But I know that a lot of people like to know how to eat and drink good. And you know that ain't easy. So that's why we can be focusing on both of those things now. So we're going to start right off with Victoria Cost. That'll be how we should eat when Christmas comes.
Christmas is, it's a season, but when it comes to eating, Christmas is a day, one day of eating a little bit differently, a little bit less healthy. It's not going to be the end of the world, but sometimes we take it a little bit too far. And it's Christmas from November through to January as far as we're concerned and what we're eating and drinking, and it gets a little out of hand. So yes, we may eat differently in the Christmas season at functions and events, but I like to remind people, you're probably not eating out at a function all 3 meals of the day, so try to keep the normal meals healthy, balanced, because we tend to be very all or nothing, 0 to 100. So we'll go from being really, on the ball and thinking, oh, well, it's Christmas now, so I could as well wake up and have a conky and a juice for breakfast, when that's not normally what we would do, right? And so, yes, when we're eating out, it's normal that you're going to eat a little bit differently, but at home, stick to your guns as much as possible. Stick to what is normal for you, which is hopefully, a balanced meal with your vegetables and your water to drink. And even then, when we do go out to functions or events, I think it's really valuable to look at the food that's there and ask yourself what you're actually going to most enjoy. Because sometimes we take food just for the sake of taking food. We're like, well, I'm going to take a little bit of everything. And then our plates are piled high, as opposed to, okay, well, there's rice and peas, but I could have that any day of the year. But maybe there's jug or there's, yam pie, things that I don't maybe typically cook that often for myself outside of the season. So focus on the foods that you're going to most enjoy, the seasonal foods, and leave some of the rest out, right? And I think, part of it is just from a good blood sugar management perspective, staying on top of testing your blood sugars, because there can sometimes be that aspect. Maybe patients who just don't want to check their blood sugar because they suspect it probably is high, and they think, I just don't even want to confirm what I think already to be true. So staying on top of frequently monitoring your blood sugars at home, so you know if it is beginning to get a little too elevated, and understanding what foods are going to have the biggest impact on your blood sugar. So again, if we're thinking seasonal foods, and maybe there's different types of meats and things, so maybe someone has turkey and ham, yes, it's very high sodium, but at least if people understand how food affects their blood sugar, they may know that, okay, these protein foods aren't going to really have any kind of effect on the blood sugar, but all the starchy foods, that's what's going to digest into glucose or sugar and raise the blood sugar. So you can kind of be a little bit more strategic with how you build your meal. And I will always be an advocate any time of year, but especially at Christmas, for not leaning into these sweet drinks, because that is something, I will have, clients who generally don't really drink sugary beverages, and then they'll hit me with, well, it's December now, so I had to get some malts and some this and some juice and some soda, and nothing's going to raise your blood sugar like a sweet drink is going to raise your blood sugar. So I would always try and, even if you're going to have a dessert, don't have a dessert and a sweet drink.
Sugar in the black cake, salt in the ham, chemicals in chicken, grease in the lamb. Sugar in the black cake, salt in the ham, chemicals in chicken, grease in the lamb.
The Maria Holder Diabetes Center.
As we are continuing on the Maria Holder Diabetes Center Radio Christmas Show, sponsored by Republic Bank, we are now focusing on drinking. Victoria already deal with drinking sweet drinks, right? So we are now going to deal with drinking strong drinks. So we now go to Dr. Diane Bradford to talk about how diabetics can drink alcohol for Christmas.
If you have diabetes, you have to really think about how much alcohol you use, using it in moderation or not at all. First of all, just want to point out that alcohol is actually very toxic to the pancreas. That's the organ that makes your body insulin. So people who abuse alcohol can actually become diabetic because the alcohol is damaging, their pancreas, okay? And now that you've touched on that, you're talking about another type of diabetes again, okay? Secondary diabetes. But alcohol is a tricky one because some of the alcohol obviously has more sugar, and therefore it means that it can make your blood sugar go up, okay? That's number one. But number two, alcohol also affects the liver, and it affects how the liver can produce and process sugar or glucose, several hours after you consume it. So some people can actually have low blood sugar several hours after using, the alcohol. And if you're on medication, that can be a kind of, that can be a bit of a messed up thing, really, where you end up with high sugars and then low sugars. So we always tell people, if you're going to drink alcohol, drink in moderation, do not drink in excess. And also you want to make sure that you're maybe having a meal or something after you drink, okay? So I don't mean like go and drink a lot and then go and eat, but make sure that you're not drinking like empty stomach, but always in moderation.
Everything in moderation. Everything in moderation. Everything in moderation. Everything in moderation.
The Maria Holder Diabetes Center.
Whiskey a little bit, rum a little bit, brandy a little bit, whiskey a little bit, wine a little bit, when you dine a little bit. Good health for Christmas.
For a long time I was prolonging not to have my eyes, I went to get an eye screening, I checked for a long time. But because of I had a cataract operation 5 years ago at the hospital, and then when we go to the hospital, because of the amount of people that goes to the clinic there, you don't always get special attention. And just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance, and I can say that I was well satisfied with what they did with the result. Right now the cataract is under control. So I would say yes, that is very good. It's very good for diabetics.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time,
Managing diabetes means treating the whole patient, not just blood sugar.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how to get your simple digital eye screening done for just $100. But members get 10% off.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
Hey everyone, I'm Marsha White from the Barbados Diabetes Foundation. Season's greetings.
The Maria Holder Diabetes Center.